Dear Iman University students, today we're going to continue with Solutions, Part II. In Part 2 of Solutions, we'll talk about how to express concentrations for solutions, and then we'll take examples of solutions administered orally. To start with, concentrations of solutions can be expressed in different ways. There are many ways to express concentration, and you should be familiar with these ways. What you have in this table are a few of the ways that will allow you to express your concentration in a given solution. So, let's talk about these examples and then give you examples of other ways to express concentrations. What you see here first, you might be given a number as a percentage, W/V. I will give you an example. For example, let's say I said 2% W/V. What does that mean? It means, see, this is weight. There are 2 grams. There is 2 grams. See, always when you say 2%, it means grams. If it is weight, it's gram, not milligram, not kilogram, it's gram. When I give you the number or the concentration of 2%, it's 2 grams in 100 volume of solution. In 100 volumes, what is this volume unit? It's ml. So, 2 grams in 100 milliliters solution. What is this 100 milliliters? It's actually the vehicle or the solvent plus the material dissolved in the vehicle or the solvent. So, 2 grams are present in 100 milliliters of solution. This 100 ml is not only the vehicle but the vehicle with the solute, making 100 milliliters. This is the expression of the first one. Before I move to the second one, etc., you need to know that sometimes I may not give you W/V. I just tell you 2%. For example, I tell you the concentration of sodium chloride in water or in a solution is 2%, and I know I'm talking about sodium chloride, which is a solid, and the solution is a liquid. I know this. That's why it will be automatically W/V, even though I'm not mentioning that. Sometimes, someone might ask me, give us another example where it's V/V, volume by volume. For example, if I tell you a hydroalcoholic solution, any alcohol mixed with water, and I tell you this hydroalcoholic solution, the content of alcohol is 49%. If you remember, this is the approximate alcohol concentration in diluted alcohol. In this case, you have 49 milliliters in 100 milliliters of the solution. I may not tell you V/V, but you should know that because alcohol is a liquid in water or the solution is also a liquid. So that's why if I don't put it, you should know it's V/V. But if I'm mixing, for example, solid with solid, for example, I tell you I'm mixing sodium citrate or sodium chloride with sucrose or glucose, and this mixture is a solid mixture. I tell you the concentration of sodium chloride in the mix with the sugar is 2%, and I may not give you the V/V or W/W, etc. So you should know because I'm talking about solid with solid, and this mixture is solid, so I know it's W/W. This means that there are 2 grams of sodium chloride in 100 grams of the mixture. So if I don't give you, you should normally be able to tell. But if I give you, then you stick to what I give you, even though it might not be what you expect. So if I give you V/V, it means you stick to that. If I don't give you, you should start predicting or thinking what it could be. There are other ways, for example, as a ratio. Here, you have to be careful. Sometimes, I will put the ratio 1:2, and that's it. In this case, it will be like 1 part of this compound and 2 parts of compound or substance B. Now, B can be solid, liquid, etc., and A also can be solid or liquid. In any way, the units here, for example, can be gram with gram, so 1 gram from A to 2 grams from B. But if for this ratio, as you can see here, I put W/V, it will now become totally different. In this case, if I say 1:2 W/V, then it means 1 gram in 2 ml. This is how it becomes, so 1 gram in 2 ml. If it is 1:1000, it will be 1 gram in 1000 ml. If it is 1:100, what is this 100? Is it the other compound, B, or is it the mixture? No. In this case, when I say W/V, since I added it, then it means the mixture, the preparation is in 1000. It is not only the compound B but A and B together. You got it. But if I don't do W/V or V/V or W/W and I just say 1:2, then it's very simple. It's 1 part of A with 2 parts of B. Similarly, if I say 1 to 100 V/V, then it means it's 1 milliliter of the compound or the solute dissolved in 100 milliliters of the preparation. This is how this is translated. Similarly, if I say 1:100 W/W, then it's 1 gram of the solute or constituent in a mixture of 100 grams because it's W/W. There are other ways for you to know. We have, for example, milligram percent. For example, I tell you, it's 2 milligram percent. Because I used milligram percent, I will not say 2 grams in 100 milliliters solution. No, I would say 2 milligrams in 100 milliliters solution. When I write it as W/V, it will be 2 milligrams because I mentioned here milligram. If I don't mention milligrams, it will be 2 grams in 100 milliliters solution. Now, what you need to know is how solutions are prepared. Normally, most of the solutions are prepared by simply mixing the solutes with the solvent. This is how most of the solutions are prepared. Now, we can classify solutions as solutions for oral administration and solutions for topical or external applications. So, oral solutions are for oral administration, and preparations or solutions for external applications are for topical application. We need to be familiar with the constituents of oral solutions because, in many cases, they will contain flavorants. Flavors are desirable in order to make the medicine more attractive to the patient. They flavor it, for example, with lime, orange flavors, etc. Also, for the same purpose, to make it attractive, they may color it. They may also add stabilizers. Stabilizers mean that you don't want deterioration to happen during storage. Deterioration can happen in solutions, oxidation will make changes, chemical reactions, and crystallization. The compound or the solute in the solution may crystallize out, maybe because of high concentration. In this case, I need a solubilizer to stabilize the solute. And, of course, preservatives may be needed in order to prevent contamination. These are frequently encountered in oral solutions. Also, you should be aware of the dangers of adding components to a vehicle where a reaction can happen. You don't want to add 2 components, for example, a weak acidic substance and a weak basic substance, in a vehicle and then have an interaction happen between them. Also, you should be aware of the typical doses. When I'm talking about liquid solutions, they will usually tell you 1 teaspoonful or 2 teaspoonfuls, or they will tell you 1 tablespoonful. You should be familiar with these terms and what they mean in pharmacy. When we say 1 teaspoonful, we refer to 5 milliliters, a measurement of 5 milliliters. When we say 2 teaspoonfuls, we are talking about 10 milliliters. The teaspoon is smaller than the tablespoon, the one that you eat rice with, etc. Now, the tablespoonful is 15 milliliters. So, you should be aware of that. Of course, we prefer not to use teaspoons or tablespoons. We prefer to use a calibrated container in order to measure these volumes. That's why, in many cases when you buy the solution bottle, what do you find? You find that the cap is calibrated, and this will allow you to measure a specific volume from this solution. Now, we will talk about the examples of oral solutions. The first thing we will talk about is dry mixtures for solution. The product will be a dry powder or a dry mixture, it's solid. This is the product. But when you want to use it, you have to reconstitute this powder and add the solvent, the proper solvent, with a certain volume or up to a certain volume. Shake it and make sure that the material dissolves, and then it becomes a solution for consumption. Now, why is this done? Why is the solution not ready? It's better that it's ready because, in this case, we can guarantee that the manufacturer is using the right water, the right volume, etc. So why is this not available as ready-to-use solutions? Why is it a dry mixture? The answer to this is that once the dry powder is reconstituted and made into a solution, the expiration date will be very short. A typical example is cephalosporins, like penicillins and cephalosporin derivatives. These are antibiotics. You go to the pharmacy, buy a bottle containing dry powder, and then add water to it to make a certain mark on the bottle. Antibiotics are a typical example. But sometimes, they also use a powder because the powder will occupy a smaller volume in the pharmacy. Sometimes, if you can rely on the customer to add the water, in this case, you can sell them sachets, and then they can go home, put it in a glass of water or a cup, and then add water to reconstitute the powder and drink the solution. In this case, maybe it's not the stability that really is the concern, but maybe the volume. If the pharmacy already has it as a ready-to-use solution, then it will occupy a bigger space in the pharmacy. This can be another reason. Many antibiotics, when they are reconstituted into liquid form into a solution, will have an expiry date of 7 to 14 days. What should happen on the product's label is that it should mention the expiration date for the dry mixture and the expiration date for the reconstituted powder. So, both expiry dates should be noted. But if this dry mixture, like in the case of antibiotics, what does it contain? Does it contain only the antibiotic? No, it will contain all the formulation components, including the flavors, any coloring agent, buffers, etc. The only difference is that water is not added, and it's added only when it's prepared. It's preferable that the pharmacist prepares this, but actually, most of the time, you will do this at home. Make sure you use good water for that purpose. Examples, as I said, include penicillins and cephalosporin derivatives. They are good examples of that. We talked about dry mixtures in the form of dry powders or granules. Now, we are talking about solutions and already made liquids. Examples of that include oral rehydration solutions, or sometimes called oral rehydration salts. Here, it can already be in the form of a dry mixture. So, it can be both, actually, the dry. The reason for the dry is so that the product does not occupy a large space in the pharmacy. But you can also find it as ready-to-use solution. I know that you already had this preparation in your previous course, Pharmaceutics 1, and I think you had to prepare the oral rehydration solutions or at least have a discussion regarding it. And what you should advise the patient with regard to using oral rehydration solutions. Now, what are they used for? The condition is diarrhea. What is diarrhea? Diarrhea is a normal physiological body response, and this happens normally when your body is trying to get rid of toxins, things like rotavirus or E. coli. It's trying to get rid of that. How does it get rid of that? By diarrhea. Diarrhea causes these microorganisms or these pathogenic entities to get out of the body. So, logically, you should not stop that. Many people take what do? They take loperamide or some other drugs in order to try and stop diarrhea. But actually, the best approach is not to try and terminate it too quickly. Rather, the best approach is to try and replenish or replace the lost fluids and electrolytes from diarrhea. It is more dangerous for infants to lose fluid and electrolytes than adults. In all ways, it's very important to replace the fluid and electrolytes, but it's more dangerous in infants. What is the basic concept behind oral rehydration solutions? What you will expect if you eat or drink anything is that diarrhea will not allow anything to be absorbed. So how come this will be absorbed? How will the electrolytes replace the lost fluid and electrolytes? Well, now I will explain this. In our gut, especially the small intestine, glucose is absorbed actively. Actively means there is an active absorption, not passive. Not because you have a high concentration it gets absorbed, even if the concentration is small, the glucose gets absorbed into the blood. This absorption is an active process. Even when diarrhea is present, there is an active absorption of glucose. This is important because, when you lose a lot of nutrients and your gut is not absorbing the nutrients and losing electrolytes, you might go into shock and hypotension, and you become very weak. Now, glucose is important for giving you energy, right? In this process, where glucose is absorbed actively, sodium will be required. The nature of this active absorption is that sodium must go with glucose. If sodium goes with glucose, sodium is a cation, then you cannot have only a cation going from one side to another. You will need an anion absorption. So automatically, you will have sodium, for example, let's say for the argument sodium citrate or sodium chloride, getting absorbed. If sodium chloride gets absorbed, then water must accompany that. You cannot have sodium chloride getting absorbed without water being absorbed. So what's going to happen? In this case, glucose, sodium cation, and an anion, the anion can be chloride, citrate, or bicarbonate, will be absorbed. Because of that, water is going to be absorbed, and this will circumvent or short-circuit dehydration. They like to add it with bicarbonate or citrate because usually, in diarrhea, the blood is a little acidic because of metabolic acidosis. Bicarbonate and citrate compounds are alkaline or alkalinize the blood. They will actually increase the pH of the blood in order to circumvent acidosis. Usually, the concentration of glucose in the solution will be 2%. The sodium ion will be available in the solution at 60 milliequivalent per liter. This is another way of expressing concentration, equivalent per liter or per ml or whatever. This is a type of concentration. We also have molarity and millimolarity. I'm sure you have encountered these units before. So, this is a way to express concentration. Here, they are talking about sodium because sodium is very important. As I said, it goes with the glucose, so they know how much sodium they need. But they are not going to add sodium as an ion. They will add it with bicarbonate or citrate along with glucose. As I told you, it can be available as a ready-to-use liquid or as a powder for reconstitution. It's very, very important that if you want to reconstitute the powder, you add exactly the specific amount, not more, not less. You cannot add more, and you cannot add less because if you do that, the osmolarity will change. If it changes, it will not have the right effect. The isosmolarity or the osmolarity will change, and osmolarity is very important in this case because it can worsen diarrhea if you change the concentration. That's why you need to stick to the concentration, and that's why you should not eat and drink juices while taking the oral rehydration solution because they can change osmolarity. So you should not eat or drink when you want to take the solution, otherwise, you spoil everything. Now, the second oral solution is the oral colonic lavage solution. From the word lavage, this solution is like washing, to wash the colon. When do you want to wash the colon? You want to clean the colon. Normally, when the doctor asks you to clean the colon, the doctor can then investigate your colon, the large intestine. They want to see if there is something in the colon. You have a procedure to test or to insert, for example, an endoscope to look and investigate the colon. So you need to clean the bowels. There should not be any stool or solid materials in the colon. What do you have? The doctor might prescribe a balanced solution of electrolytes with polyethylene glycol for you. It's given as PEG. There are many different PEGs with different numbers, PEG 200, 400, 600, etc., and there is PEG 3350. Usually, the pharmacist will take this. It will be in the form of a powder, and the pharmacist will reconstitute this powder containing PEG and electrolytes. The pharmacist will take and reconstitute it in a specific volume of water to make an isoosmotic solution. When the customer or the patient drinks this solution, there will not be a net absorption or loss of electrolytes from the body or absorption of electrolytes from this solution into the body. It's isoosmotic, meaning it has a similar osmolarity to the body and the blood. So, there is no net absorption or secretion of ions. That's why it's isoosmotic. This solution, because it contains electrolytes, has a mild salty taste. This solution is given in large volumes. The patient needs to drink 4 liters of this solution. How can they drink 4 liters? This is a huge amount. No. Actually, what they're going to do is take it in cups. A cup is 240 milliliters, and every 10 minutes, they will drink 240 milliliters quickly. Usually, they start at 6 o'clock, let's say, and they start drinking 240 milliliters. Usually, bowel evacuation will begin within 1 hour. But anyway, they start at 6 o'clock, and by mid-morning, maybe 10 o'clock, after 4 hours, they will be ready for the doctor to investigate the bowel. This happens in 4 hours. 3 hours for drinking to finish all of the 4 liters, and then in 1 hour, evacuation of the bowel will be completed to be ready for the doctor to see them or to see the patient. This is how it's done. Another solution, which is usually given when there is constipation, is magnesium citrate oral solution. Magnesium citrate oral solution has other names, such as citrate of magnesia or simply citrate. Magnesium citrate or citrate of magnesia is usually a clear solution, but it can also be slightly yellow. It is provided as an effervescent liquid, so it has a sweet taste, an acidic taste, and a lemon flavor. This is a nice taste to have, it is acidulous, like sour, with a sweet taste. What is it used for? As I told you, it is used in constipation. It accelerates defecation, which is why it is classified as a saline cathartic. Another oral solution, which might be in the form of a powder sachet where you need to dissolve it, is usually effervescent. You have the sodium citrate and citric acid solution. Now, this solution, when you see citrate, is an alkaline. Magnesium citrate is an alkaline. But we are not using it here as an antacid or something. We are using it in order to accelerate defecation. Why are we using sodium citrate? We are using it as a systemic alkalinizer. Do you want to make the blood alkaline? Actually, the aim is to make the urine alkaline. If sodium citrate is absorbed into the blood, this will cause the urine to become alkaline because the blood goes to the kidneys, and from the kidneys, sodium and sodium citrate will be excreted. So, the urine will be more alkaline. When is it desirable to have more alkaline urine? We have certain cases, such as when there is too much uric acid. Uric acid causes cystine calculi or crystals that will cause painful urinary tract conditions. If the urine is alkaline, then it will dissolve these crystals, and they will not form. The same thing applies when anti-gout agents are used. Agents that are used to treat gout, such as probenecid, will increase the secretion of uric acid in the urine. Again, in order to prevent the crystals from forming, you usually administer with it a systemic alkalinizer such as sodium citrate. Uricosuric agents are used in the condition called gout. You will see that these are sachets, so you have to dissolve them in water when you will realize that this is actually an effervescent powder. Another type of solution that is given orally is syrups. What do we mean by syrup? You have to be careful here. Why do you need to be careful? Because syrup is something general, but there is something specific called simple syrup NF, National Formulary. The exact concentration of sugar in water is given in the United States Pharmacopoeia. But when we say syrup, syrups can be vehicles with different concentrations of sugars. Syrups are concentrated aqueous preparations of sugar. When I say sugar, I mean sucrose or sugar substitutes like glycerin, sorbitol, etc., with or without flavoring agents and medicinal substances. Syrups can be medicated or unmedicated. Unmedicated syrups are flavored syrups. If it doesn't have the medicine, it is unmedicated. Syrups are given orally for the purpose of delivering the medicinal agent inside them. What do they usually put in syrups? Usually, syrups contain antitussive agents. Antitussive means to prevent coughing. They also contain antihistamines. Antihistamines are for allergic conditions that can cause coughing or other symptoms, such as skin, nose, or eye issues. So, you give antihistamines. Most syrups contain antitussive agents and antihistamines. What are the components of medicated syrups? Usually, they have sugar or sugar substitutes, and this provides two things: 1, sweetness, which is important, and 2, viscosity. That's why syrup has a high viscosity. Syrups may also contain antimicrobial preservatives because you have sugar and water, which is a good medium for the growth of microorganisms. Syrups can also contain flavoring agents, coloring agents, stabilizing agents, solubilizing agents, thickeners, etc., in addition to the drug. Purified water is used along with the drug and these components. Because syrups are given orally, it's better for them to be sweetened and flavored. The source of sweetness is usually sucrose, but it can also be non-sucrose-based syrups, whether it's artificial sweeteners or something like sorbitol or glycerin. The problem with sucrose is that if it's given to a diabetic patient, it can cause issues. As a pharmacist, it's important to counsel the patient and check whether they are diabetic or not. You cannot give a diabetic patient sucrose-based syrup because it will cause a high increase in blood sugar. Syrups contain a large proportion of sugar. One important thing to note is the simple syrup NF, National Formulary. This one has a high concentration of sugar. When I say high, I'm talking about 66.7 grams of sugar in 100 grams of the solution. The amount of water added is less than the sugar. In such concentrated sugar solutions, you may not need a preservative. In simple syrup NF, you might not need an antimicrobial preservative, but you might need it in some other types of syrups. Why? Because the sugar concentration is high. If the sugar concentration is high, is it a good medium for bacteria to grow? No. The reason is that bacteria like sugar, but they also need water. If there is little water, all the water is with the sugar. The water surrounds the sugar molecules, and no more water is available for the bacteria. Bacteria cannot grow because the water in the syrup is associated with sugar and is not available for microorganisms. One of the characteristics of syrup is specific gravity. Specific gravity is very similar to density. When you see specific gravity, you should know that it has no units. This is very important. But I want you to imagine specific gravity as grams per ml. Imagine it like that. Again, specific gravity has no unit, but imagine it as grams per ml, which means every ml of this simple syrup or syrup NF has a weight. What is this weight? It's 1.313 grams. One of the ways to check whether the syrup you have has enough sugar is to weigh it. Each ml of the syrup has a weight of 1.313 grams. So, 100 milliliters will have a weight of 131.3 grams. If someone comes to you and tells you, this is 100 milliliters of syrup according to NF, and I want to sell it to you, you can weigh it. This is one of the ways to check whether the syrup has the correct concentration or not. Now, let's talk about elixirs. Elixirs are another type of oral solution. Elixirs are clear, sweetened, hydroalcoholic solutions. What do we mean by hydroalcoholic? It means they contain both water and alcohol. They are used for oral administration and are less sweet and viscous than syrups. Why? Because syrups contain a high concentration of sugar, which makes them more viscous and sweeter. Elixirs, on the other hand, contain alcohol, which reduces the viscosity and sweetness. Elixirs can better solubilize both water-soluble and alcohol-soluble components because they contain both water and alcohol. This is one of the advantages of elixirs over syrups. However, because they contain alcohol, they are not suitable for children or individuals who should avoid alcohol. Elixirs are classified into medicated and non-medicated elixirs. Medicated elixirs contain active ingredients, such as antihistamines, sedatives, or other drugs. Non-medicated elixirs are used as vehicles to prepare medicated elixirs. For example, suppose you have a drug that is not soluble in water but is soluble in alcohol. In that case, you can use a non-medicated elixir as a vehicle to dissolve the drug and prepare a medicated elixir. The alcohol content in elixirs can vary, but it is usually between 5% and 40%. The higher the alcohol content, the better the elixir can preserve itself without the need for additional preservatives. However, if the alcohol content is low, you may need to add preservatives to prevent microbial growth. The preparation of elixirs involves dissolving the water-soluble components in water and the alcohol-soluble components in alcohol. Then, the two solutions are mixed together. It is important to add the aqueous solution to the alcoholic solution, not the other way around. Why? Because if you add the alcoholic solution to the aqueous solution, the alcohol concentration will decrease rapidly, and some of the alcohol-soluble components may precipitate out. By adding the aqueous solution to the alcoholic solution, you maintain a higher alcohol concentration during mixing, which prevents precipitation. After mixing, the solution is filtered to remove any undissolved particles, and the final product is clear. Another type of oral solution is tinctures. Tinctures are alcoholic or hydroalcoholic solutions prepared from vegetable materials or chemical substances. They usually contain a high concentration of alcohol, which acts as a preservative and solvent. Tinctures are not commonly used for oral administration because of their high alcohol content and strong taste. Instead, they are often used for topical applications or as flavoring agents in other preparations. Examples of tinctures include iodine tincture, which is used as an antiseptic, and opium tincture, which is used for its analgesic and antidiarrheal properties.